Hi, and welcome to Unmasking the Trans Movement with John Mueller. I'm your host, Brad Wilder. Today on the show, John is here with a special guest, and this guest, brings a lot of knowledge. Retired Dr. Jay Allen. We're going to talk about, some pretty serious stuff today with regards to medical surgeries that are going on within the trans movement themselves. There is a lot of horrific things that have transpired over the last year. And these surgeries aren't new to the last year either. They've been happening for years. But the push is what we're really here to talk about today, and this push just continues to get stronger and stronger. So let me welcome in Dr. Jay Allen and John Mueller. Guys, thank you very much for being here and on the show today. We've got a lot to discuss and really review in terms of unmasking medical complicity in the trans movement. So why don't we start with you, John, and kind of get an idea of, where we're headed in today's episode from front to back, just in, get people excited about what's to come in this episode.
Brad, thank you. And it is a privilege to have Dr. Jay Allen with us. He and I have gotten to know one another, and he has begun speaking out, issuing his concerns about what are false narratives being pushed by the trans activists, moving things toward a very dangerous position where kids and also women are then placed in vulnerable positions. But Dr. Allen, thank you for joining us.
You're welcome.
To speak out on this important topic.
You're welcome.
And we're going to be talking about your concerns about these myths that have made their way into the mainstream. And then in part two, you indicated you would be good enough to stay with us for a second half. You, being from Maine, you have issued some very forthright concerns about legislation that was snuck through, that was rammed through. And it is modeled after, or a fair bit of it is modeled after California. And so as you and I were talking, it seemed very appropriate that you should kind of sound the alarm in what's coming down the pike for the rest of the states, as well as in Canada, various provinces. So we're going to be looking at the myths that are pushing these dangers and dangerous procedures onto kids, unnecessary procedures, really would amount to experimental medicine and Nazi-like experimentation. And then we're going to look at the political and the legislative push. So again, Dr. Allen, thank you for being with us.
You're welcome.
Well, talk to us about how you decided to start speaking out, because rare is the medical practitioner that's willing to. We've had Dr. Patella, we've had Dr. Von Mall, but there are a few, but just too few. So tell us how you began to decide to speak out.
Well, there were a couple things that came together to prompt me to speak out on this. Primary one was I was concerned about some of the things I was reading. So my background is I have a bachelor's degree in biology from MIT, a master's degree in biology from Carnegie Mellon, and then medical school in Philadelphia. It's part of Drexel now. And, they were saying things like there's more than two sexes, which is completely, utterly ridiculous. And they were talking about sex being assigned at birth. And as I mentioned previously, I've probably delivered about 200 babies, and not once did I assign a sex at birth. I denoted the sex at birth, but I never once assigned sex at birth. And it makes it sound like you're sitting there in the operating room or the delivery room, flipping a coin to decide which gender or which sex this baby's going to be. And that's not how it happens. I mean, there are very clear indicators. I mean, a 5-year-old could tell you the sex of the baby just by looking at it. Now, there are a few exceptions, but those exceptions do not mean that there's more than two sexes, because they're called intersex diseases. And those are combinations of the two sexes. They're not a completely separate sex. That would be like calling a chocolate vanilla swirl a completely different type of ice cream from chocolate and vanilla. So that was part of what
Dr. Allen, out of all the babies you delivered, because we actually interviewed a guest who has the intersex condition, and it's a myth that's being pushed as far as this is very prominent or prevalent out there. So in your experience, having delivered all those babies, did you encounter any that were intersex?
Well, part of the problem is I worked in the military system where I did all those deliveries, so there wasn't necessarily follow-up. But the chances I saw one that was intersex are very minimal. There's about 1 in 5,500 births that is an intersex birth, and having delivered only 200, it's highly unlikely that one of those 200 would have been intersex. I mean, it's possible, but we weren't getting the follow-up because either I move in 3 years or the family of the patient moves in 3 years, so we just don't have that follow-up.
So the fact that that's being used to try to implant into the public psyche that somehow this can be a very ubiquitous kind of generalized condition out there, and that now that this is part of the public discourse, we have all these young people that suddenly are awakening to the reality that maybe they were intersex or they were assigned incorrectly at birth, their gender. They were secretly a girl in a boy's body or vice versa. From a medical perspective, that is hogwash. Would that be correct?
Right. And what they're trying to do is expand the intersex category to include things that are not intersex. For example, aneuploidy, which is where there's a mismatch in the number of chromosomes. And in this particular case would be the sex chromosomes. So when there's a mismatch, you get a different phenotype than you would if it was a normal 46XX or 46XY. But in each one of those cases, it's very clear what sex that patient is. For example, a 46X0 is a Turner's patient. That's the Turner syndrome. They are very clearly female. And then 46 or 47XXY, that's Klinefelter's. That's very clearly male person. I mean, they still have testicles, they still have scrotum, they still have penis. So they look like a male, they have all the organs that a male would have. So trying to include them in intersex is part of the thing they're trying to confuse people about what intersex conditions are. Another thing that they're doing is they're taking the dimorphism within the sexes and saying that that applies to the gender spectrum. So, for example, if you have a boy that's short, they'll say that's more consistent with being female, and they'll try to include that as an intersex. Where you see it more is, big example is polycystic ovarian syndrome. Patients with this condition, it's called PCOS, they tend to have more facial hair than the average woman. So they'll say because they have more facial hair, they're on the male end of the female spectrum. Again, working on trying to get them female, working on getting people to identify as part of a spectrum, but they're still very clearly female. They still have ovaries, uterus, vagina. They can still deliver, they can get pregnant. It's more difficult for them to get pregnant, but with infertility practices, they can get pregnant. So they're still women, but that's how they're trying to expand this intersex category to make it look like it's more common than it really is. The numbers that you see them quote is about 2% of patients. are intersex. The actual number is 0.018%. So it's not even close.
So they are manufactured. They're pushing a grand lie.
They are.
And hence the term, the trans deception. This is really cult-like finesse in terms of mental and emotional manipulation, or we used to call it brainwashing.
Yeah. And the other thing too is, excuse me, the other thing too is that if you look at the vast majority of transgender people, they're normal males or normal females. They're 46XX or 46XY. They have the normal phenotype for their sex. So a 46XY would have the scrotum, the testicles, the penis, the urethra, the prostate. 46XX would have the vagina, uterus, ovaries, fallopian tubes. So they're normal from the sex point of view. So they can't be considered they can't be considered intersex. But because they're trying to confuse people, people think that, well, maybe I am intersex. And that goes along with the gender spectrum. They're trying to argue that this gender spectrum is really what we need to look at. Another thing they're doing is they're looking at other species of animals where there is either true hermaphroditism or where there's pseudo-hermaphroditism. And they talk about a couple things. There's a fish that when the male dies, one of the females goes into hiding for a little while, and when she comes back out, she has turned into a male. The problem is that all throughout her life, this fish has had both female and male organs. And it's just that once the male of that group dies, the ovaries shut down and the testicles start cranking up production. So they switch from being female to male, but they have both structures. The other thing they talk about, and this was kind of crazy. So there's a bird, I forget the name of it offhand, but there's two different types of this bird due to an inversion of chromosome 2. And what they see is the ones that have the inversion have the red crest on their head, where the ones that don't have the inversion have a white crest. The red-crested individuals, male and female, tend to be more aggressive, more promiscuous, going around to different members of the opposite sex. Whereas the ones that have the white crest tend to be more homebodies and stay with the nest. So if you have a red-crested male and red-crested female together, they tend to ignore the nest, and that nest obviously doesn't produce. And if you put the white-crested male and female together, they tend not to get enough food for the chicks. But so the preferred pattern is for the red-crested male to mate with the white-crested female, and that's like 98%. And then vice versa, the white-crested male with the red-crested female. So they're arguing that there's 4 different sexes in this species of bird. But the problem is...
And trying to equate that, right? They're trying to say that humans, as created in such a magnificent way as we are, they're looking for exceptions within the animal kingdom, all the way down to, as a matter of fact, there's a good little video, very creative. Somebody put it together. It's sort of a rap music video called "We're Not Clownfish," And so I don't know if you've heard it or not, but
No.
it's packed full of all these different ways that the trans activists are spinning things, all these different little phrases. Well, what about this? What about this? And then it will reference a clownfish. And so the chorus continues to come back, but we're not clownfish. It's like, oh. So these activists love to spin language. They love to try to capture the narrative, and it will confuse people until people can really go back to both their own intuition and the facts. And so you being a medical doctor, if ever there used to be a field of science, well, science should be dealing with facts. So we counted on doctors to be detached from their emotions. Hopefully, it's still good bedside manners, but we wanted them to be detached in terms of just deal with the facts. And now what you're seeing has got to break your heart and raise very significant concerns, because you're seeing medical schools that have been influenced by a lot of money. And now, before you know it, we're hearing that doctors are being told there are not distinct genders.
Right. And, getting back to those birds, the male red-crested and the male white-crested both produce sperm. The female white-crested and female red-crested both produce eggs. So it's not like they're different sexes. It's just that they have different properties within that sex. But yeah, one of the things that you see is that they are starting to deny biological reality. And I'm not sure if you're familiar with Colin Wright, but he was a developmental biologist. He was working on his PhD. And as he was getting close to the end of his PhD, he started hearing all these issues about the gender spectrum and all that. And he knew from his research and his teachings or his education that those things absolutely were not true. And he was told, yes, you're right, but keep it quiet because you won't be able to find a job. You won't be able to get tenure. You won't be able to do any research. And he said, well, I can't be quiet, because if I am, then I'm letting a lie get out, and I need to speak for the truth. And so he now works for the Manhattan Institute, I believe, and talks about the gender binary and other issues related to transgenderism. And that's sort of how I got into this as well. I was reading some of his stuff. So for me, it started basically as an interest in biology. And then I was seeing how they were messing with medical language as well. And that led me more into the medical field. So that's where I'm concentrating right now, is debunking the medical myths that go along with transgender.
Dr. Allen, let's talk about that. The trans movement, really, if we have some parents or grandparents that are just tuning in, the trans movement really can be summarized or boiled down to the analogy of a moving sidewalk, that if you can get a kid onto the sidewalk, it's going to take them somewhere. Ultimately, it's going to dump them out on a surgeon's gurney. So we're going to go through various stages of mental and emotional manipulation. It'll start with affirming and then social affirmation. So before you know it, the young person is starting to, quote unquote, identify with the opposite sex, and then they're going to start to dress and act like that. And then there's going to be the change. As a matter of fact, now you have schools that are subverting, of course, parental authority and parental rights, and they're doing this covert thing where they allow the kids to change into clothing at school or use a different name, different pronouns. And then little by little, you have the introduction of the medicalization of these kids. Speak to the different processes, because at first you have wrong sex or cross-sex hormones being introduced to these kids that are going to first blocking puberty, then the cross-sex hormones, and then eventually the amputation of sex organs. So from a medical doctor's perspective, speak to that issue. Is it ever necessary? What are the dangers? What are your concerns as a doctor?
Well, what you hear from the transgender activists is that gender affirming care is based on evidence. So it's evidence-based. It's safe. It's, I forget the rest of the list. But, they're basically saying that it's all these things, where if you go back and look at it, yeah, you could say it's evidence-based, but really the evidence is expert opinion, which is the lowest level of evidence. There have been multiple systematic reviews that have come out and shown that there's more harm than benefit. So it's not really evidence-based. They talk about how every single medical association within the United States confirms gender-affirming care. And that's because they haven't looked at the data or they're ignoring the data because, again, the data just isn't there to support what they're doing.
And Doctor, I'm going to bring up, just so people are aware of what we're talking about, this is supposed gender affirming care. This young gal had her breast sliced off by this doctor. That's further down in the right on the moving sidewalk because they are interfering with puberty and then they're blocking hormones. So we have, all in the name of this gender affirming care, right? We're being told that taking the breasts off of young women who are emotionally and psychologically troubled, and then also convincing them that they can be male. So we're going to take a skin graft and create a fake penis, right? That somehow this is helpful to do to young women.
Yeah.
So they're taking perfectly healthy bodies and scarring them for life.
They are. And what you find is that once you start them, even with social transition, once you start them on that path, almost 98% of the kids will go on to full transition, so medical transition. And in my mind, that's conversion therapy. Because if you just left them alone, 68 to 98% of those kids would desist as they go through puberty. They would stop saying, oh, instead of being a girl, I'm actually a boy. That goes away if you let them go through a natural puberty. But by intervening, they have set these children on a path that will almost definitely confirm that end up with them being transgender and end up with them being medicalized and surgically transitioned.
Dr. J, puberty is confusing enough for children as it is, as they're going through it. Now they throw this on them, and it obviously is messing with all kinds of kids' heads these days. We're seeing kids that are, they're participating like it's a fad, and it's here today, and tomorrow there's something different, and the next day there's something different again, and they're bouncing around a lot. Are they the same people who are going out for these surgeries eventually, or are the bouncers just kind of playing the fad?
Well, I think you see some of both. You see some people that are just dabbling in it, but you also see some people who get introduced to it and then they get sucked into the vacuum and never are able to get out of it. So one example of someone who woke up was Chloe Cole. She had a double mastectomy, and when she woke up from that, she said this was a mistake. So that's all the further she went, the double mastectomy. But she knew that her problems were not being addressed. So the problem you have with the transgender ideology is that the demographics have changed very significantly in the past couple of years. So, 20, 30 years ago is mostly either young boys, 3, 4, 5 years old, who thought they were women, and then older men who thought they were women. The current demographics are that it's primarily young girls, so prepubescent and teenage girls that are identifying as transgender.
We've got a graphic that shows, right, not only, and a lot of this can be traced back to when all these procedures became billable from the DSM-5, right? It went from dysphoria or gender identity disorder to dysphoria. And then the program I Am Jazz, there are a number of different programs, but yeah, look at, it used to always be boys, young boys. If they were confused about their gender, they were starting to play with more traditionally feminine dolls and things, and parents would get concerned. But there's a good graphic now, a few years old, obviously. This is what, about 4 or 5 years old, but this is from the UK.
But the other difference you see in these two demographics is in the old demographic. So most of the gender affirming care protocol is based on what's called the Dutch studies. And in the Dutch studies, they looked at these young boys, and one of the exclusion criteria was that they could not have any other psychiatric conditions. They couldn't have depression, anxiety, PTSD, any of that. What we're seeing with the current population, these young girls, is that almost all of them have some sort of psychiatric condition. And the transgender activists will say, oh, they have depression and anxiety because they're not being affirmed in their gender identity. They call that minority stress. But if you go back through the medical records of these patients, you'll see that the anxiety and depression and all of that started 3, 4, 5 years before the ideas of being transgender appear. And usually what it is these people are looking for a way to get rid of the psychiatric issues they have. And gender transition is being sold as a panacea, where if you go through this transition, your depression's going to go away, your anxiety is going to go away. There was even one author who said that autism would go away if you, and that's completely impossible.
And as you're talking, here's another graphic. We're seeing an amalgam. We're seeing a coming together of a lot of different influences. The shirt that this young woman has on her is Satan respects pronouns. So you're seeing with a lot of these kids clear evidences of underlying issues. Because also look at how many tattoos this young lady has on her. Now, people may speak out, say, how dare you assume that, tattoos have anything to do? Well, those aren't just mild tattoos. Plus, if we look at the kinds of tattoos, look on her left elbow that is raised, that is a bat.
Yeah.
Is that a normal tattoo to have? As a matter of fact, this type of shirt that's being marketed, it is being marketed, let me see here, very aggressively. So we even have pins now. I think this was being marketed at Target.
Really?
So there's a clothing line. So you cannot tell me that these are normal kids that are just somehow being influenced, when, as a matter of fact, you have an amalgam of religion now, in a religion that is probably not beneficial, right? It's going to teach lack of self-restraint. that's entering into these kids. And then you see a lot of the graphics now that are coming out that are blurring sexes, and you will see time and time again, there's the pentagram right on that young girl's left arm. So these are clearly troubled kids that are easy target then for manipulation. They've got a lot of angst, and so they're easily manipulated. But these are lifelong implications that we're talking about, Doctor. Would that be a fair assessment?
Oh, absolutely. I mean, these kids, if they transition completely, will be on medication the rest of their lives, especially if they've had their gonads removed. Because, even if they continue to think that they're female, they'll still be on estrogen the rest of their life. But if they detransition and go back to being male, they'll need testosterone the rest of their lives. So either way, you've taken a physically healthy person and converted them into a lifelong patient.
Medical care and treatment forever.
Yep.
With the cost that's associated with that, because the prescriptions aren't free.
Yeah. So the cost, the amount of money that the medical system makes from each patient is estimated to be between $1 and $1.5 million for each patient.
Wow. Who's paying that bill?
Well, mostly insurance companies, because they're required to cover it. So that includes.
Last long, can it?
I don't know.
You'd think they'd get a little tired of it if so many people were doing it, because they couldn't afford it.
Yeah. Well, that's part of the reason a lot of people were not doing it beforehand. But I think it was Obama who said that transgender surgeries need to be covered. And once that happened, then a lot more people started getting the transition surgeries and the hormones and all that.
Are we really talking about that big of a percentage, guys? Based on population, would you say that's a big percentage? Because it really isn't, guys. We know that.
That's right.
That's all over the world, every minute of every second of every day. This is very much sporadic still, and that's a good thing. But I guess.
Well, and Brad, you're exactly correct, and that's part of what we want parents, grandparents, and other good people to think through. That this is such a small percentage of the overall population, and this percentage of the population is being mentally and emotionally manipulated, unduly influenced. So what is going on to where all this emphasis, and it's not a helpful or healthy emphasis, it's going to scar kids for the rest of their lives. You're going to create pharmaceutical patients the rest of their life, medically needy individuals. So why would people do this? What is the push? The Biden administration has made this such a priority. Doctor, as you emphasized, Obama made this in the U.S. Now, Brad, you're in Canada. How has this happened in Australia and New Zealand? Doctor, if you're willing to stay around, you indicated you would be. We're going to look at what's happening legislatively, backdoor, middle of the night, fast tracking kinds of legislation. California has been doing it, and it's even made its way to Maine. So you have spoken out. You wrote an article. We're going to review that, and you are sounding the alarm as a medical doctor, and we're very appreciative, Dr. Allen, that you're willing to lend your expertise.
Oh, you're welcome.
Thank you both for being here. Part one is, time is limited, so here we are. Thank you very much for being here, both of you. Part one's been very eye-opening for a lot of our viewers. The information that they receive from professionals who aren't bound by that piece of paper that's going to hold them in a place that continues to preach the same script. You guys are giving the information that they really do need for the help to get through this and get past this, if it's come to their door or if they have their own grandkids who are going through this sort of stuff. So thank you both. This is Unmasking the Trans Movement. Stay tuned. Part 2 is on the way. I'm Brad Wilder. Till next time, remember, it's not our kids' fight, it's our fight.